2, Kilifi 2, Laikipia, Bomet, Nakuru, Meru, Nyandarua, and Kajiado, 1 case each. In Kitui, the 54 cases come from the following sub-counties: 27 from Kitui Central, 8 each from Kitui Rural and Kitui West, 5 from Mwingi Central, 4 from Kitui East, 1 case each from Kitui South and Mwingi North. In Nairobi, the 23 cases are from Embakasi South 4, Westlands 3, Dagoretti North, Dagoretti South, Embakasi West, Makadara, and Ruaraka, 2 cases each, Embakasi East, Embakasi North, Kibra, Langata, Roysambu, and Starehe, 1 case each. In Uasin Gishu, the 11 cases are from Ainabkoi and Soi 1, while in Kiambu, the 9 cases are in Kiamba, Kiambu Town, Ruiru, and Thika, 2 cases each, and Lari 1. The rest of the breakdown will be in the brief. On a positive note, 173 patients have recovered from the disease, 107 of these from the home-based care program, and 66 have been discharged. Recovery is now therefore remains at 599. We want to thank our healthcare workers for the good work that they continue to deliver out there in saving the lives of our people. I thank you.
Nancy Okware kutoka KBC, umezungumza kuhusiana na idadi ya maambukizi kuonekana kuondoka katika kaunti ya Nairobi na kuelekea katika kaunti nyingine, kama vile leo hii tumeona ya kwamba kaunti ya Kitui imeongoza kwa idadi ya maambukizi. Je, kama wizara ni kipi ambacho mnafanya ama kwa ushirikiano na zile kaunti ambazo pengine zinatarajia idadi ya maambukizi kuongezeka katika siku za usoni? Je, mnapanga kuongeza idadi ya watu ambao wanapimwa katika zile kaunti ama ni mikakati ipi zaidi ambayo mtaweka? Shukran.
Dorcas Wangera from Citizen TV. Yesterday you had intimated that you would make public the revised burial protocols after WHO also released the same. I don't know when this can be made public, because we have people who are asking. And then secondly, even at this time, the cold weather, are we seeing an increase in other infections, particularly TB, pneumonia, and influenza and the flu?
Beldin Oliaula from KTN. With the low records of deaths reported and also decline of positives, can you say the virus in Kenya has become less severe?
Please repeat that question again. I didn't hear it well.
I'm asking, with the low positive numbers, can we say the virus in Kenya has become less severe?
Less severe.
Helen Aura from NTV. With our research and the funds that have been put in terms of our research, how far are we as a country in our research for our vaccine?
Okay, thank you. Kitui, with rising numbers, and it's not only Kitui as we mentioned, we have said that the curve that we follow, the national numbers, is an aggregate of the entire country. And when you break that down now per counties, you will find that each county has a different history and different trajectory. But because the major areas where the largest numbers of cases have originated from, or the clusters, what we have even called high risk or hot zones, have been these counties of Nairobi, Mombasa, Kiambu, Kajiado, the general metropolitan area. We are seeing a smoothening a little bit of these major metropolitan areas, but now there seems to be rising numbers in some of these other counties. In due time, these counties will also be able to manage those numbers. Are we working with these counties? Of course, we work as a national government very closely with all the county governments to provide them with the necessary support to do the testing, the follow-ups, and to be able to gather these data that give us an indication of where we are in terms of the spread of the virus. So yes, we do work very closely with them. As soon as when we see numbers begin to rise in any particular area, that area draws particular attention again in terms of being able to enhance the level of monitoring through testing for those areas so that we can follow it very carefully. We can identify individuals who are confirmed cases. We can then be able to get them into care and isolation so that we are able to break that cycle of transmission. And we will continue to work with all the counties. We are watching very carefully most of the counties, those especially that seem to be showing from day to day increased numbers. Regarding the burial protocol that we talked about, this is something that is work in progress. I think Dr. Kuria had talked about it. Maybe he can respond to the timelines in terms of when this protocol will be made available to the public. Are we seeing any disease increase in other diseases because of this cold season? We have been monitoring that very carefully. We have been looking at trends of particularly diseases that we know flourish during the cold season, and these tend to be respiratory diseases. Forward to see whether indeed you're having a larger number of COVID cases that might not be registered and you're missing them out. So there are a number of ways that we are looking at these numbers and to determine the impact of this COVID-19. What I can tell you is that the trends we see in terms of the other diseases is nothing unusual. They are more or less similar trends as previous years. But in fact, when we look at respiratory diseases in general, actually we have seen a lower trend this time of the year compared to the same time last year. So we don't have much worry in that area that COVID-19 is being masked as other diseases. Low numbers, low positives. Does it mean the virus is less severe? We can't say anything about the virus having changed in terms of the severity of the disease it causes. Low numbers don't tell you that. What the low numbers just tell us is that the transmission is not, has been interrupted, and it's not transmitting as fast or as widely as before. So those and that's what the containment measures are meant to do, is to break the cycle of transmission. So it tells us that we are not able to transmit, that the transmission of the virus